Great, we're here at the World Vaccine Congress in Washington, D.C. I'm Ed Kelley, Chief Global Health Officer at ApiJect, and I'm joined by Anna, who's here. And Anna, maybe you could introduce yourself and also the Congress.
So I am Anna Hindley-Skelt, and I am a senior conference producer for the World Vaccine Congress, Washington and Europe. And as you probably know, the World Vaccine Congress is a conference and two series, our Washington event and our European event. We're currently in Washington, D.C. on the second day, and we have 4 days full of exciting content covering the whole of the vaccine value chain. We have hundreds of exhibitors here in the expo hall, 12 exciting conference tracks, loads of keynotes going on, and loads of workshops. It's a very fun event.
Good. Well, ApiJect is here because we're a vaccine delivery company, and this is one of the places that actually cares about vaccinations as well as vaccines. So I wondered, and we're doing this series to talk to a whole bunch of people here, experts, and also the organizers, about what happens at these types of congresses in general, but specifically what happens here. Mm-hmm. One of the things that you and I have talked about on the side has been that the World Vaccine Congress spends time worrying about the actual content. I mean, there's tons of networking, obviously, that happens around, but really worries about the content. And I just wonder if you could say a word about, that's a big job, there's tons of stuff covered here, if you could say a word generally about how you work on developing the content for these types of congresses.
Yeah, so it's an ongoing process that never really ends, and I can't take all the credit. We have an absolutely wonderful production team, and we work really, really hard on it. And it starts before the last one even finishes. So conversations and planning for 2025 is ongoing and has been for some time. But when we actually start to put pen to paper, then what we tend to do is a lot of research. To summarize it, it's basically a job of listening. So we'll try and get as much feedback from attendees, speakers, sponsors, exhibitors, and of course our wonderful advisory board, who, bless their souls, give so much time to us to really help us put together the best content that we can. And of course, there are a lot of themes that are ongoing, and we'll know that we can, guarantee will be covered in some way, shape, or form within the event. And then it's really throughout the cycle of production, just about honing down on those, consistent topics and what the new progress is there, and any new angles, any new challenges, and then identifying what else is new and feeding that in as well. But it's a really dynamic process. The agenda is always changing, and we're always researching. We're always thinking about things. I mean, I find myself in the most random situations, and I'll go, oh my God, that's such a great idea. That's something that it'll make me think of something, or it's something that can inspire things that we incorporate into the agenda. So it's a big process, and it takes a long time, and I couldn't do it without the help of everyone that gets on board.
That makes so much sense, and I can imagine it makes for a lot of sleepless might be overemphasizing it, but late nights, particularly leading up to, as sort of speakers come in and out and all these types of things all the time.
Yeah, I mean, sometimes I don't think sleepless because, beyond production, we have an amazing team that also help us. So, help us and, do their own things. But, we can really rely on each other. And I think especially the more that I've grown and learned, the less these things kind of stress you out. You learn how to deal with it, and you more sleepless because you're working with people across loads of time zones. So with each of the panels, we make sure that everyone's prepped. So organising 6 people in 6 different time zones to get on one call. Sometimes that's, you'll work a little bit later, but I don't think it's not awful. And it's also really fun because at that point, you're looking forward to it, and it's so close, and most of the work is done. It's a lot of admin really then.
Yeah. That makes so much sense. Well, another thing we were talking about was the aspect of the public-private mix that you have here. It's a benefit being in Washington, D.C., obviously, where we've got a massive source of public sector officials who could easily come over here, so that's a great choice. But I just wonder, it's also one I've noticed in other congresses for the World Vaccine Congress, that is not so present. You would think it would be more present, but it's not so present in other places that tend to be like public health folks, or they tend to be industry folks. They don't mix so much. Do you want to just comment on why that's important to the World Vaccine Congress?
Yeah, this is something that we work really, really hard on, and it's a big part of the reason why, why the Congress is where it is. In DC, we have access to the government officials, and it makes it easier to really gain that balance. But I think the reason that we prioritize it so much is because it's an acknowledgement of the interconnectedness and interdependency of the whole system. Vaccine development is an ecosystem, and no one single entity works in isolation. If one aspect or one part of the development cycle is faltering, then it impacts all of them. And it gives the opportunity to bring everyone together and foster that collaboration and, really come together to work on different solutions. And you hear it with so many things, like if you ask someone, what challenges are you kind of facing in your work? A lot of the time it's something like, we don't, I'd really like to hear what the regulators have to say on this. And so much of it can be addressed, or started to be addressed at least, with just a conversation. So it's bringing people together in that way. And an example of that is in one of our workshops yesterday, we had Jerome Kim and his colleagues talking about their public-private partnerships. So IVI, Hong Kong University, Cambridge University, and the Jockey Club have put together this new public-private partnership for vaccine development, and it's funded by gambling. And to quote Jerome slightly, probably not his exact words, probably not verbatim, but when he was kind of rounding off, he said, when we think about public health, we have to think about gambling and vodka, because these are examples of really innovative mechanisms that, bringing people together, have come up with new sources of funding and different ways, and all of that starts with a conversation. And to have a conversation, people have to be in the same place.
That's so interesting, and it's so interesting that you brought up gambling. Actually, one of the, not to divert about ApiJect, but one of the things we worked on in ApiJect is this question of traceability, which came up a lot during COVID. How are we going to roll out this massive immunization campaign, know that the doses haven't expired, know that we're giving the right dose to the right person? But actually that's like a peacetime challenge in much of the world. And right now, the farthest we've gotten is around some experimentation with barcodes. I mean, there's some other stuff that's actually here at the Congress, barcodes, but it's usually on the secondary packaging, so the big boxes. But actually being able to, we have the technology to track individual doses, and it's mostly around RFID chips. We've been looking at how to attach RFID chips to actual pre-filled syringe doses, so that you could literally tap your phone, know that it's the right dose, that it hasn't expired, it gets automatically loaded up to the cloud, and that could work in Africa as well as it could work in Europe. But the technology for that comes from gambling, from poker chips, because right now most of the world's gambling casinos use some kind of RFID to track these chips, which yeah, you can track millions and millions and millions of dollars on a super active basis on a casino floor. You can definitely track vaccines. So I think there's a lot of crossover.
Not that the World Vaccine Congress promotes gambling.
Exactly. It's adapting technologies for use in other places.
Yeah, adapting technologies and that inspiration for solutions to challenges can come from anywhere. And I think, a lot of the time in a place like this, you can run into people or be introduced to people that you would have never otherwise had the opportunity to interact with. And that's when things that these innovative solutions can come into play. And we really hope that by bringing everyone together, we can foster that collaboration. But also, not just hope, we know we've had some real success stories of partnerships and things that have happened because people met here. And that's really nice.
Yeah, that is really nice. Well, let me finish off with this question about sort of looking forward. ApiJect is based here in the US. We worked a lot with the US government, but we have an office in Geneva, Switzerland, where I'm based. We also have an office in London, where you're based. And I know that even though we love Washington, D.C., we love another city a little bit even more in my own heart, I'll say. So we have the World Vaccine Congress Europe coming up. I know you have a lot to do with that, so maybe you could say a word about it and what's upcoming, what you're excited about?
Yeah, so we have the World Vaccine Congress Europe, which is taking place in Barcelona from the 28th to the 31st of October, so please do save those dates in your diary. I know you already will. You already have. But to kind of follow on from what we've discussed, there's so much that we have planned. I think some of the things that I'm particularly excited about, and I know have been really big conversations in the area at the minute, one of them is global equity. That's such a big conversation, and I think is a big peacetime conversation. So we'll be looking at putting together a workshop on that and a keynote panel as well. And I think, it's only important if we can help everyone. And it's not like beyond all the exciting technology, it's the World Vaccine Congress. So it wouldn't be right if we weren't covering those things. And also, some of the conversations that we've had is it's not just about the vaccine, it's about the vaccination, the implementation, the delivery. And I think one of the big questions and themes that are coming up at the minute is, okay, we've got all this progress that we're seeing and such rapid progress post-COVID with technology and mRNA, and it's all so exciting, but can we get the uptake to keep up and stay caught up with that progress and with that development? How can we make sure that we are actually getting vaccines in arms and getting vaccines in arms to everyone? And then another big one is therapeutic vaccines. That's really taking off, taking the world by storm. Thank you, Merck and Moderna. But there's loads that's going to be going on, and we're all really excited. And like I've said, our job really is a job of listening. So while we have loads of things planned, we'd love to hear what everyone else wants to see. If we're missing anything else, if there are things that maybe we haven't included, we want to hear that, and we want to keep working on it, and we will absolutely do our best to make sure that it is the best World Vaccine Congress Europe yet.
Good. Well, I'm planning to be there, so I'm looking forward to it. Listen, I'm going to let you go. Thank you guys for joining, and we'll be doing some more interviews while we're here at the World Vaccine Congress, Washington, D.C. Thanks a lot, and thank you, Anna.
Thank you so much.